Spring has sprung, and so is the April 2022 edition of the CFP Journal. So if you're practicing family medicine in Canada, or if you're studying for the CCFP exam, you might want to know what are the most clinically relevant articles in this month's edition. That's what we do here at CFP Distilled. We're going to look at pointers on peripheral artery disease, pointers on kids with long COVID, kids with a blistering diagnosis, and there's another mystery diagnosis that the research says you and I are not good at picking up on. So let's find out what that is here at CFP Distilled.
Long COVID in children. What do we know so far? No great evidence-based guidelines. A lot of the research is just case reports and case series. But what can we offer to our patients? Well, we can offer close follow-up and treatment for the symptoms of long COVID in children. And what is that? There's fatigue, it can be headache, it can be joint muscles, aches and pains. So remember to keep treating the symptoms while we wait for more evidence-based guidelines.
So what could this diagnosis be? A patient comes to see you and they have cancer. They're in palliative care and they are complaining of a sudden increase in pain, confusion, hallucinations maybe. You go to examine them closely. Light touch causes extreme pain. They've got allodynia. And then when you look more closely at their muscles, they've got myoclonus and tremor. And if we don't catch this diagnosis early on, they could end up with seizures. These are the diagnostic criteria for opioid toxicity. When patients are using an opioid and it has metabolites, and these metabolites build up and cause these severe adverse drug reaction symptoms. So how do we manage this? First of all, make sure we identify it. The research says you and I are not good at picking up on this diagnosis, so let's try and improve that. Secondly, we're going to try and increase hydration. Third, reverse whatever could be causing it. Perhaps they've got a renal issue that could be reducing their clearance of the metabolites. And finally, consider reducing or switching the opioid to something else.
Chronic bullous disease of childhood. Not all rashes are infectious. Consider this in your next diagnosis when you look at a childhood rash. Now, what are we going to do for these patients? Clinically, we're going to look for the string of pearls sign. The string of pearls sign. And what are we going to do? We're going to do a biopsy. After we get the results, we can reassure our parents that this particular disease is not infectious. Treatment can involve colchicine, steroids, and NSAIDs, and probably referral to a dermatology, especially if you're writing that CCFP exam.
Are you studying for the CCFP exam in fall 2022 or spring 2023? Well, then you might be interested in joining us at the review course in family medicine. Mark your calendars. We are going to be in Toronto on September 10th and 11th, 2022. Hope to see you there.
Exercise. It's not only good for you and me, but what about your patients with peripheral arterial disease? Yes, it can improve maximum pain-free walking distance by up to 200 meters for your patients who use some form of exercise therapy. Multiple RCTs have confirmed this. No change for mortality or amputation, but you can increase the duration and how far they can walk pain-free. So remember to offer that to all of your patients.
May 2022 has another edition of CFP Journal coming out. Don't miss CFP Distilled that month by subscribing. We hope you enjoyed this and we will see you then. Take care.